Hello, I'm Mary Moore Hamrick, the Don Evans Family Managing Director of Domestic Policy here at the George W. Bush Institute. And I'm speaking today with retired U.S. Navy Captain Dan Goldenberg, who is Executive Director of the Call of Duty Endowment. Welcome, Dan.
Thanks so much, Mary Moore. Great to be here.
Well, I am so excited to talk to you because, as you know, each year more than 200,000 military service members return to civilian life. How many of these veterans are medically trained and could help fill the much needed healthcare jobs that we have here in the civilian world?
Yeah, great question, Mary Moore. And typically every year about 10,000 transition out. And so this is Army combat medics, Navy hospital corpsmen, and Air Force medical techs. And from what we know statistically, about half of them want to continue working in the civilian medical space. And if you start running that number forward, you see how many of them actually don't get to do that. We estimate that there's between 30,000 and 50,000 former medics and corpsmen out there who would love to work in the industry and are not presently doing so.
Well, given that, Dan, what is the pathway for these medically trained veterans to transition from the work they've been doing on the battlefield into the civilian world?
You know, the most minimally trained, let's take combat medic, the most minimally trained Army combat medic, for sure could be an EMT. Probably for sure a basic level EMT, possibly an intermediate level EMT. But the fact of the matter is, after they receive that initial training, medic training in San Antonio, which by the way costs the taxpayer about $100,000, most of them go on to significantly advanced follow-on training. It could be, for instance, for Navy corpsmen, it could be Corps school. For any of them, it could be X-ray technician school, could be phlebotomy school, so they can draw blood, all this kind of stuff. Almost all of them go on to get extensive continuing training, which is really important and valuable. But our baseline is that every one of these folks should be able to serve as an EMT. They should be able to ride in the back of an ambulance. And we can talk about that more later. But that's the baseline. There's also opportunities for far advanced skills. If you take the Special Operating Forces medics as an example, all of them are qualified to be a paramedic, which is the highest level of EMT for sure. Some of them are well on their way to nursing credentials or physician assistant credentials as well. So a lot of untapped potential amongst this group.
So you've really got a huge variety of skill sets, lots of training, much as we need in our civilian world today. Why aren't these veterans transitioning? What are the barriers to entry to them? It makes sense to me that if they are this well trained, what is stopping them from getting those jobs, those many open healthcare jobs that we need to fill?
Yeah, it's something we've thought about and explored for several years. And, while there's an inclination to look for nefarious intent, it's not really that, we don't think. It's more, it goes back to the civil military divide. It's a lack of realization of the talents and experiences and training the military provides in the civilian community. So let's take, for instance, the example of EMTs. For instance, every combat medic coming out, as I mentioned before, is certified to be a civilian EMT. But states get in their own way by creating additional licensure requirements to get that license in the state from their certification, or in many cases, there are at least, for instance, 10 states and territories where they give you no credit for your military medical training. You literally have to start over, including my state, by the way, in many cases, California. It's a real problem. And again, I don't think it's based in any sort of nefarious intent. It's just a lack of understanding of what a medic, a corpsman, and Air Force medical tech brings to the table. They're just sort of out of sight, out of mind. When you have such a small percentage of the American people serving in the military or connected directly to it, there isn't an understanding. One of the really interesting things that came out of the Vietnam War is the entire field of physician's assistant didn't exist before the Vietnam War. The medical establishment at the time saw so many combat medics coming back with such great talent, where they knew they could go above and beyond what they were doing. They created at Duke University the physician's assistant role for combat medics. Here we are 50 years later, the huge irony is that now, once again, former medics and corpsmen are having a hard time getting jobs or getting the training as physician's assistants, even though the field was created for it. So there's, again, it's not nefarious. I think it's just out of sight, out of mind. We have to educate employers and definitely state regulators on the value these veterans bring to the job market.
So what I hear you saying, Dan, is that these healthcare workers are properly and extensively trained in their service of their country, but when they come home to their local communities in their states, they're required to get certain licensing or credentialing. And what does it look like if you have to start over? And what sort of things are they being asked to do before they can get back into the medical world?
Yeah, so let's, like, just because it's ubiquitous, everyone understands what EMT is. Let's start with that because, again, at the baseline, is something every one of them should be able to do. There's only 6 states right now, amongst all our states and territories, only 6 that make it easy and clear for these former medics and corpsmen to become EMTs.
And that's an emergency medical technician. Emergency. Yes.
Okay. When you think of the people riding the back of the ambulance, that's who we're talking about. Yeah, emergency medical technicians. Exactly right. There's 3 levels. There's basic level EMT, intermediate level EMT, and the highest level is paramedic. So, there's 6 states that make this easy. There's 22 states that actually have the on the books, the regulations that should make it easy, but they do a terrible job of communicating. They don't put it on a website. Some of these states we called up every one of them, every state and territory, to talk about this when we did our research. Some of them literally, their answer is, well, they just have to get us on the phone. They have to find the one person in the state who can say yes and get them on the phone. It's crazy. And then you've got 18 states or territories that provide some pathways for the military, but they layer on additional ridiculous requirements. For instance, literally telling the service members, hey, you got to go back 7, 8 years, find the individual military instructor who taught you a particular course when you were going through your initial training and get them to sign off on it for every single course you took in the military. It's nonsense, or they won't give you credit. And then there's 10 states and territories where they literally give you no credit at all for what you've done in the military, and you have to start over. And in many cases, the courses they have to take are courses they could teach easily. And it's just such a waste of money, a waste of time. And, quite frankly, a lot of these service members say, you know what? If you're not going to appreciate me, I'm going to go do something else. And they do. I can tell you, I had a 3-tour combat tour Army combat medic driving me in an Uber one day in Los Angeles. And I was asking why I wasn't working in healthcare. And he said, I'd love to. They just don't recognize what I did in the military, which is sad.
Oh my gosh. So I think you said that are there half a dozen states that really do this right? Talk to me a little bit. Talk to me. I want to get a shout out from my home state of North Carolina.
Of course.
Talk to me what right looks like. Tell me what this looks like in how might governors and state legislatures, what does right look like, and how might they adopt some of these programs? What does a great state look like?
Yeah, I mean, there's 2. Let me call it 2 examples. The great state of North Carolina and the great state of Arkansas. So both of them kind of do the same thing, which is, one, they make it simple. There's sort of 3 requirements. One, you have to show your DD-214. That's your discharge paperwork, your official discharge paperwork that shows you served as a medic, a hospital corpsman, or an Air Force medical tech. So that's proof you did it. It's proof you received the training, the minimum level training and beyond. The second thing is they need to have a current national EMT registry certification. This is not a military certification. This is a civilian certification that says nationally, yes, you passed our tests and you're current. And then the third thing is a state level background check. That's it. Just those 3 things. DD-214, National Registry of EMT, and state level background check. That in both North Carolina and Arkansas, that's all they require. The other thing they both do that's really great is they communicate it clearly. They have special websites just for veterans transitioning from these fields who want to be EMTs. They made it super easy. And that's it. The beautiful thing about this solves a real public policy issue. we have a healthcare staffing crisis in this country. And some of the great entry-level jobs are EMT jobs, which can lead to, further specialty and allowing what these veterans, once they get into the healthcare community, to move up and do other things and apply other skills they know and get more training. And we have, ambulances standing idle in rural communities and urban communities because we just don't have enough qualified people to do this job. So, there's great opportunity here. Governor Hutchison, I got to give a special shout out to Arkansas, literally after the report came out, called me up with staff and said, what else can we do? How can we do more? And that was so motivating to me. I think, this is about leadership. It's not a partisan issue. It solves a big public policy, about big healthcare issue. It doesn't cost anything. There's really no reason for states not to embrace this approach.